Hi, I'm Bailey Orquist. I had the topic of socioeconomic status and gender and career. My test represented my test represented as male in career in one category and then female and family in another category at first. I then had to press the letter E for male names and then career for focused words such as promotion, manager, and then it would then flash to the female names, and I have to click the letter I for female names and family focus words such as wedding or children or kitchen or laundry. And then each time it kind of would switch back and forth between like male and laundry and then female and manager. And then at the end, I found out that the test showed that I was moderate in an automatic association with males in career and females with family, which I think it does unfortunately make sense because our society is like this overall. We have a deep-rooted idea of how gender and society is, and it's how it's supposed to be. Generally, the male role is like the breadwinner, right? And the female role is like the housemaker, the homemaker. Especially myself, currently, I just had a child. She's going to be 1 on Tuesday. And staying home to pursue my like nursing like wants and needs and degree, I really feel the pressure of having to be the role of a homemaker while being home with my daughter, Lennon. I know it's not expected of me, but I am home the days that I'm not in class, and I have to study, I have to do these things, and I'm taking multiple classes at a time, and then I just feel like I need to do these, like do the laundry, keep up with the dishes, make dinner, but that's not anything that my husband has put on me. It's just the cultural expectations. In healthcare, males and females both receive a lot of bias, discrimination, and assumptions regarding gender roles. Some examples of gender stereotypes would have to be like how doctors treat illnesses in men versus women. In one of the studies that I found, it was that doctors often viewed men with chronic pain as being brave or more stoic versus a woman in chronic pain as emotional or hysterical. This, in another study, it's also expressed that doctors also treat women's pain as a side effect of mental health, as we're more emotional beings. They feel as if women could, the mental health condition rather than physical condition, because women tend to be more emotional. This would often lead to women not wanting to be seen by a healthcare professional because they feel as if they're not being taken seriously, they're not being heard or listened to, and some women might even think that they could be being overdramatic and just kind of push off their symptoms and not really worry about it and just wait it out. I feel like this would be a really good example of SDOH, which is social determinants of health, leading to possible delays in care and poor outcomes. I know that's not like really anything we have to hit, but it's very true. Like, women will not come back in the future if they feel like they're not getting good care, as well as many men and other people who are being discriminated against. The role of gender in careers is also a part of my topic. I didn't really know the best way to address it all. And many of the articles that I found are also located within the medical setting, which is unfortunate, but it is very career driven. In this study, it was expressed that despite the increasing of representation of women in medicine, professional setbacks were still happening. It was said that women physicians suffer burnout rates higher than men at 50.7% versus 38.2% for men. For women, alignment between personal and professional priorities is essential for career and success satisfaction. Although men share these values as well, over time it's witnessed that they just really want like their priorities shift, and men become more focused on the research and clinical outcomes rather than emotional alignment, personal, professional priorities, because it's not essential to their career as like women think it is for them or seem it to be, which I personally feel the same way. I need like enlightenment and gratification in my career. I can't just keep doing a job that I don't like just to make money. Another study explored the perceptions around working part-time. Even though the faculty supported the idea, the commitment of the practitioner as well as the long-term goals of the practitioner were brought into question by like the faculty. Many women also explained that they felt as if they were letting their team down when pregnant and leaving for maternity leave. There's also a huge stigma around a woman going on maternity leave and feeling guilty for that. And that's really unfortunate, because we should change that system and make them feel supported, because everyone needs to come into this world being a child. It's also stated that women as doctors often show more compassion and empathy and actually spend more time. This may harm productivity between the patient and like the hospital and the doctor's office, and numbers and pushing patients in and out and really wanting to hit those numbers. But also it's just really understanding the patient as a whole, and as a woman, they seem to spend more time in really creating that understanding the patient as a whole. And it's just creating those belief and values, like the iceberg, the cultural iceberg like video that we watched. Just really understanding the beliefs, values, and perceptions of a patient is really essential. I mean, obviously not spending all day, every day with a patient and learning who their mom's cousin were. Like, that's not what I'm getting at. It's just really important for trust with a patient and really understanding like who you are, and they're going to want to come back, and they start building a rapport with you and really wanting to be a part of your practice and who you are as a practitioner, and getting to know you as a practitioner. For interventions with considering the work environment in a healthcare setting for women, like examining the type of leader and leadership responsibilities would be essential for a woman to really see what the institution needs as a whole. Like what else can we integrate for this institution, and what would be more effective, really looking at the numbers and what brings patients in, as like the rapport we were talking about, or compassion, empathy, time, sending out more patient surveys as what they liked and disliked about their practitioner, their environment, office staff, how they were treated, other follow-up questionnaires asking if they felt like their concerns and ailments were addressed and taken care of. That's like a huge... When I worked in a doctor's office, we would pass out SIOH or SDOH packets, and lots of people did not like they felt like they were invasive questions, like, do you have affordable food? Do you have affordable housing? Do you have this? But in a lot of cases, we really found a root cause of some issues. Like, there was multiple patients that didn't have a ride, didn't have the money to spend on medication, so they wouldn't come, like leading to a whole spiral of different situations. One patient even expressed that he couldn't read it and was very frustrated he was given it every time. So like just sitting down and listening to a patient and really understanding where they're coming from is a lot of the root cause of things. Like, you're not just pushing people in and pushing them out. You need to listen to them, not make people feel over dramatic for sharing. Like, making women feel emotional or hysterical for just being in pain versus a man who is brave and stoic. That just doesn't align with what we are trying to get at. Yeah, thank you.